Alright, the female reproductive system. Female reproductive system consists of ovaries, fallopian tubes, uterus, vagina, Bartholin's glands, vulva, and breasts. Ovaries are the female gonads or the sex glands. They're small, almond-shaped glands. They're located in the pelvic cavity and they are attached to the uterus by ligaments. They have thousands of small sacs called follicles in each ovary, and each follicle contains an immature ovum or female sex egg. When the ovum matures, the follicle enlarges and then ruptures to release the mature ovum. That process is called ovulation, and it usually occurs about once a month. The ovaries also produce hormones that aid in the development of the reproductive organs and produce secondary sex characteristics. They produce estrogen and progesterone for that purpose. Next are the fallopian tubes. They are two tubes about 5 inches long, and if you look at transparency 80, you'll notice in the picture that there's 80. 79 and 80 are both about the female. You notice it has fimbria that fit over the ovary. The fallopian tubes are two tubes about 5 inches long. They're attached to the upper part of the uterus, and the lateral ends of those to the sides are located above the ovaries, but there's no direct connection. They have finger-like projections called fimbria that help move the ovum released by the ovary into the fallopian tube. And it serves as a passageway for the ovum as it moves from the ovary to the uterus. What moves it along is peristalsis. Again, we have peristalsis, which is that rhythmic wave-like movement of the muscle layers of the tube that helps move the ovum along. And also lining the tube is cilia, which we've talked about in other systems, hair-like structures on the lining that keep the ovum moving towards the uterus. Now, fertilization, or the union of the ovum and the sperm to create new life, usually takes place in the fallopian tubes. But let's say that the ovum doesn't get into the fallopian tube. It floats around in the abdomen because it didn't go through the fimbria into the fallopian tube. Sometimes if that happens, then that's called an ectopic pregnancy, where it unites with the sperm and starts to develop, but it's not in the uterus, it's out in the abdomen. That will cause pain and we'll need to have a surgical removal because there's nothing there to sustain the life. Also, if the ovum implants into the fallopian tube, obviously there's not enough room there for a baby to develop in a tube, so that will rupture too. So that would cause pain and require surgery. Those do not often take place. The next one is the uterus, which is a hollow, muscular, pear-shaped organ. It's located behind the urinary bladder, but it's in front of the rectum. Remember, the rectum is the last part of the digestive system where the stool collects and then is expelled from. So the uterus is behind the bladder, but in front of the rectum. There are three parts: the fundus, which is the top part where the fallopian tubes attach, the body or corpus, which is the middle section, and the cervix or narrow bottom section that attaches to the vagina. Now, the function of the uterus is it's the organ of menstruation. It allows for the development and growth of the fetus, and when the fetus is born, it contracts to aid in the expulsion of the fetus. There's 3 layers: the endometrium, which is the inner layer, and that provides for the implantation of the fertilized organ and also aids in its development. That's the endometrium. And if fertilization does not occur, then that endometrium deteriorates and causes bleeding and is sloughed out of the body, and that's known as menstruation. So every month the endometrium gets ready just in case there is a baby going to be implanted, and if fertilization does not occur, then it sloughs off and you bleed, and it's known as menstruation. The myometrium is the muscular middle layer, and it allows for the expansion of the uterus during pregnancy, and that's what contracts to expel the fetus during birth. And then the perimetrium, the outer layer membrane. Next is the vagina, which is a muscular tube that connects the cervix of the uterus with the outside. It functions as the passageway for menstrual flow. It functions as receiving sperm and semen from the male. It functions as the female organ of intercourse, and it acts as the birth canal during the delivery of an infant. It is lined with a mucous membrane that's arranged in folds called rugae, just as we've talked about in other places, and that rugae allows the vagina to enlarge during childbirth and intercourse. So it does allow it to expand. The Bartholin's glands are also called vestibular glands. They're two small glands on either side of the vaginal opening, and they secrete mucus for lubrication during intercourse. The vulva are structures that form the external female genital area. There's a triangular pad of fat covered with hair that lies over the pubic area called the mons veneris. There are two large folds of fatty tissue called the labia majora. They are covered with hair on their outer surface, and they enclose and protect the vagina. There are two smaller hairless folds of tissue that are located within the labia majora, which are called labia minora. And then there's the vestibule. That's the area of the vulva just inside the labia minora, and it contains openings to both the urethra and the vagina. The clitoris is an area of erectile tissue that's at the junction of the labia minora, and it produces sexual arousal when stimulated directly or indirectly during intercourse. The perineum is an area between the vagina and the anus in the female, and the perineum can also be used to describe the entire pelvic floor for both male and female. So that's the perineum. Last of the female reproductive system is an entirely different place than the other organs we've been talking about. But the breasts or the mammary glands are also part of the female reproductive system. They contain lobes that are separated into sections by connective tissue and fatty tissue. There are milk ducts located in the tissue that exit on the surface at the nipple. And the main function of the breasts or the mammary glands is to secrete milk, which is also called lactation, after childbirth.